And action. Okay, Anu had asked me a question about metabolic syndrome. So we're going to try to explain it to you with as little effort as possible, but also explain to you how to fix it. So metabolic syndrome is a constellation of symptoms that has been all lumped together to give people a diagnosis. And just like diabetes is a diagnosis, and there are certain parameters on blood testing that you have to have, metabolic syndrome has a bunch of things. So let's talk about it. Again, you have to have 3 of 5 things. So what's included in metabolic syndrome is waistline. If you're a man and you have a waistline greater than 40, or a woman with a waistline greater than 35, first strike. Number 2, your HDL, that's high density lipoprotein. That's one of the good cholesterols, as it's labeled sometimes. It's fallen out of grace as far as whether it can help with heart disease avoidance, but it's still, if your HDL is lower than 50 for a man or lower than 40 for a woman, you have that as a strike against you. Triglycerides, which are those free fatty acids that float around, due to candies, excessive amounts of simple sugars, or alcohol. If your triglycerides greater than 150, or if it's controlled but you're on a medicine, that's another strike against you. Having a blood pressure 130 over 85, that's another strike. And finally, having a sugar 100 or above, even though it's still pre-diabetes, it still increases your chances for ultimately what metabolic leads to, heart disease. So it's included too. So if you have 3 of 5, and a lot of people will probably raise your hand and say you got 3 of 5, you have metabolic syndrome. So don't sweat. I mean, I would have treated you for a cholesterol abnormality anyway. I would have treated your high blood pressure anyway, or diabetes, or obesity. So my suggestion when you see an integrated medicine physician is, we're going to treat you anyway. But if you didn't see your doctor, or if you got labeled as you're healthy, see you next year, but yet you fit into this category, maybe you should remind your doctor that I might have metabolic syndrome. Because all the things I just mentioned are very low end or low intense disease symptoms. So, but the constellation of all 3 or 5 together gives a warning sign. I guess that might speak to the fact that with all these levels that we're supposed to watch out for, the high blood pressure level, the sugar level, I'm not talking about metabolic syndrome just in itself, the cholesterol levels, if you don't seem to have any massive diseases, then you might be deemed as okay. Come back and see me next year. I can tell you, when I first started practicing in the 90s, when we had people with high blood pressure or borderline high blood pressure, don't worry about it. You're just anxious. I'll see you next year. You're cool. But in effect, all those people I used to see in the 90s, because we let those things go, now they have metabolic syndrome, or now they have their heart attack or their stroke. So it's important to now jump. You know the diagnosis, and you can get more details about that online, NIH. So you know the diagnosis, but now we have to jump to the treatment. Usually the treatment will be first putting a Band-Aid on all these symptoms, trying to lose weight, and the fastest, most guaranteed weight in Western medicine is going to be with bariatric surgery. Sometimes it's helpful for some folks, but I think there's other things you can do. Exercise is one. Nutrition and mindful practice is another. I won't even talk about the rest of them, but there's treatment plans, whether it's medicines or surgeries, for each of the diseases that are out of control, or each of the symptoms that are out of control. And it's always good, if you need the big Band-Aid, we'll use it. Sometimes we're using smaller Band-Aids at a lower intensity, like with prediabetes. We used to use metformin in the past for full-blown diabetes. Now, because we have the label of prediabetes, and we're finding statistics show that most people with prediabetes will go on to full-blown diabetes, we're entering into the fray with even prediabetes is getting medicines like metformin, which used to be reserved. And just speaking of the disease process itself, there was never non-insulin dependent diabetes in a child prior to like 20 years ago, and now we have children with non-insulin dependent diabetes, or type 2 diabetes. So you can see the diseases in American society are ramping up and continuing. They're filtering to everybody. Obesity is also filtering into everybody, into our adolescence and our childhood. So we're having a lot of folks that are having a problem with weight, having a lot of folks with all the other diseases that come with obesity or increased waist size. So the treatment plan with Western medicine is, once we pull the trigger, consider a medication or a surgical intervention. With integrative medicine, the treatment plan is design, actually look for the root cause of where things went wrong, try to get to that time of life, recreate how things used to be and how it worked and was successful back then, and kind of reformulate it to apply to age and times now. Again, as I've mentioned in other videos, I don't want you to get skinny like you did in high school. And when I say, people ask me, what should my BMI be? And I tell them, get ready, here it is, 25. Meaning a BMI 25, or sometimes a weight that they haven't touched since high school. They'll look at me and say, that's not happening. And again, I tell everybody, it's only a goal to shoot for. Heart attack is a goal not to shoot for. So the idea again is, once you have the diagnosis, you have a treatment plan. The treatment plan conservatively is to figure out the root cause. See what's wrong in the household. See what's wrong with the desires or the satiety or the hunger hunting. See what's wrong with the lack of exercise. So I had a guy that came in today he just switched insurance, and he came to see me to transfer over care. He wanted to go see his cardiologist. And I say, okay, what for? He's got 4 stents in his heart from about 2 years ago. And he says that, I asked him about how they doing. Did the cardiologist say things are cool? And he said, yep, cardiologist said things are cool. Last angiogram was 2 months ago. So I don't have to see him for another year. And I say, well, fantastic. It's good that the cardiologist says everything is cool. Maybe I'll say everything is cool. And I look at his waistline. Could use some work. I asked him about his exercise. He wasn't doing anything. I asked him about his eating pattern, and he said he was eating healthy. And I asked him about what healthy means, and a salad a day. Not bad. But he wasn't counting calories, wasn't counting carbohydrates, wasn't following any of the authors. And that's okay. Last time he saw a registered dietitian was like 10 years ago. And I think there's a lot we got to do. Not taking any supplements. I'm sure he's got deficiencies. He's on a lot of cholesterol medicines. He should be maximizing on fiber. Probably taking a magnesium for his diabetes. Probably taking vitamin D, because all Americans are low on vitamin D north of Georgia. So, and maybe even fish oil. So all these things, again, I think medicines are great. They lower deadly disease, but they don't lower all risk factors. I think it comes down to finding the root cause, finding a way to get moving, finding a way to eat healthy, and finding a way to add some form of mindful practice. So that is going to be the treatment of choice. That will get you to live to 103. According to Dan Buettner, when he evaluated those 5 areas of the world where people are living to 103 and still active and contributing back to society, it usually was a whole food, plant-based diet, some form of belonging or a sense of belonging to the family, some form of activity, whether it's walking in the mountains in South America or getting out to nature in Loma Linda, California. There's always going to be this reverberating theme of some form of old school exercise or old school activity or old school eating or old school prayer or mindfulness. So if we can design that for the person, specific to the person, that's personalized medicine, then we have a bulletproof patient that can still continue with medicines, or if they control enough, lose enough weight, make a major lifestyle change, almost mirror like when they were in their 20s, don't need the medicines anymore, just float, don't even have to see the doctors anymore. So that would be ideal. Maybe that's a pipe dream, but that is how, Anu, that is how we utilize those diagnoses, or if you fit the criteria for metabolic syndrome, don't worry. I would still say I'll still work with you as far as trying to do as best as we can before we start piling on the medicines, because medicines are good, but they do cause side effects, and they're expensive. And the government is bleeding enough now, so taking advantage of the state insurance or Obamacare, now Trump care, whatever it's going to be, probably no care because Medicare is going to go broke soon. We still have to do our own part and make the changes of healthy living on our own. I'll guide you as best as possible, just like all my other patients, but you have to empower yourself. No matter what the diagnosis, no matter what the treatment plan, you have to empower yourself to listen, strive to be the best you can be, and then not get hurt, but also get the best kind of care that you can, or seek out care. If you don't think you're getting it, then research and keep on looking. So good question, Anu. Please tune in to Dr. Ric's Minute Clinic for the future questions that patients pose. Otherwise, stay healthy.